So it is officially the end of my 2PD year. Okay, so what was this semester like for me? Well, the UF curriculum, we went through Patient Care 4 and Patient Care 5. So Patient Care 4 was all about GI, the liver, like hepatitis and how to treat those and drugs for those. And then we did some C. diff, which is a big like epidemic in hospitals and stuff, a really hard to treat disease. We also went through like obesity and bariatric surgery, and that was a really good like field for nutrition and things like that, and how to counsel patients on best ways to try to lose weight, eat healthy and stuff like that. So that was a cool topic. And then we talked about colorectal cancer and then all types of like kidney disease and stuff and how to treat it, and you know, the role of a pharmacist in those situations. And so that was an interesting class. I did about average in that class. You know, pharmacy school is hard. And then the second like large class that we had, Patient Care 5. Now this one, I loved Patient Care 5. Closest I have ever come to getting an A in a hard pharmacy school course. It was amazing. I think it had a lot to do with the fact that I loved the topic. So we went over diabetes. Finally, we went over diabetes. So that's something that's super common nowadays, but you know, we finally just got what it is, how to treat it, the types of insulins, the types of oral medications that people use, and really understood the mechanisms and all that stuff. So I'm the most expert that I'll ever be on diabetes at this moment. So that was a really cool thing to learn about. By the way, side note, diabetes is like one of the worst conditions you could possibly have. It leads to everything. It leads to heart disease. It leads to kidney disease. You lose limbs. Like, it's horrible. Just exercise and eat right, please. And then the second segment of that, we did some thyroid and adrenal glands and disorders and stuff like that. Then we got into women's health. Now, I love this segment of the class. So we did women's health, so we talked all about birth control, contraceptives, emergency contraceptives, pregnancy and lactation. So, you know, every drug is like, don't give this to pregnant women, don't give this to women that are breastfeeding. And so this module, we kind of finally learned, well, how do we tell what kind of drugs we don't use? How do we tell which drugs are safe? So for pregnancy and lactation, that was great. And then we went through menopause and hormone replacement therapies and the pros and cons to that and alternatives and all that type of stuff, osteoporosis and all that stuff that women face. And then we went to men's health. So we talked about erectile dysfunction and prostate cancer, benign prostate hyperplasia, which is the enlargement of the prostate that happens naturally in men, no matter what. And all that type of stuff. So I love Patient Care 5, honestly. It was my favorite subject in pharmacy school so far because I had a lot of cancer, like breast cancer, ovarian cancer, and all that. So yeah, I guess the passion and everything is why it's the closest I ever got to an A. But then it all ended tragically with like 2 quizzes that didn't go so well and then the final. But for like a whole month, I had an A+ in this class. It's amazing. So I'm happy. My personal other stuff that was going on for me during this half of the semester, during spring break, I went to my Project Haiti trip. So I went last year as a trip member, and this year I had a leadership role as the pharmacy trip leader for the medical mission trip to Haiti, Project Haiti. So that was really cool to see everything, all of my buying of OTC products and fundraising for medications and things all came to fruition. We went to Haiti and it was amazing. Everything was orderly. I met some great people that were members of the trip with me, and it was a great experience. The only things I have left coming up are 2 weeks of electives. So I took my final for Patient Care 5 yesterday. And then now I just have to do, like I said, 2 weeks of electives, which is it's electives. I'm doing medication therapy management elective. If you don't remember, I work in an MTM call center. It's kind of what I do every single day. I'm at work, so shouldn't be too hard. And then we have to do our hippie rotation, so a hospital, introductory practice, pharmacy experience in the summer. So I have that coming up in the summer. And then as far as me, I'm finally getting into doing a bit of research. So I'm gonna be, I'll do a video on the type of research that I'm doing, but that's something that I have working on in the summer and coming up in next fall too. So I'm really excited. I want to be an oncology pharmacist, so you got to get residency for that, and residencies look at how involved you are in school, how good your GPA is, and then research. So finally, I'm getting the research box checked. So I'm excited. I am halfway through pharmacy school and it feels amazing. So remember, when you're struggling through class, through your prereqs, through undergrad, just remember, one day you'll be in my shoes feeling ecstatic like I am, and it'll all be worth it. Comment any questions, I'm sure to answer. Thank you, and goodbye.